and welcome to this portion of the course, applying what you had learned in Module 5, Screening and Screening Process, to be able to solve a problem-solving exercise on positive predictive value, negative predictive value, sensitivity, and specificity of a test. In this exercise, I would like to know how good are the physician's diagnosis of strep throat without knowing the result of the throat culture, which can take between 24 to 48 hours. In the meantime, patients have to be diagnosed correctly in order to be treated right away and not wait until the culture turns positive or negative. Now, if the doctor diagnosed it correctly and patients with strep throat were treated, then that's great. We have a high comparable doctor's diagnosis to the actual culture. But patients who were diagnosed with strep throat but really do not have strep throat because the culture turns negative probably were given a treatment which is not necessary. What if the doctors did not diagnose a patient to have strep throat and later on 48 hours later the patient's culture turned positive? Then the patient had to go back to the doctor's office and get treated, and they unnecessarily have to suffer up to 48 hours of discomfort before they can get their treatment. So in this exercise, we will see if the doctor's diagnosis of strep throat is as good as the culture, which is the gold standard. But again, we would like to cut the time and treat the patients that have the strep throat as soon as possible. In order to answer this exercise, the group have to work together first and foremost to fill this 2x2 table correctly, because your answer will depend on placing the correct information on the 2x2 table, because the calculation will be pulled from the 2x2 table. First, what is our disease? Strep throat. So always and always remember, disease goes on the column section, specifically on this cell that's throat culture positive. Throat culture negative. Or another way of calling it is people with strep throat and no strep throat. In this column portion, we are trying to find out the instrument, which is MD diagnosis positive for strep throat and MD diagnosis of negative for strep throat. So let's look at the exercise. The study included 213 patients. Immediately put that number where all the column and all the rows totals 213. Reading to this exercise, 58 patients have throat culture positive. So the total of patients that have strep throat culture positive is 58. but 44 of these were diagnosed by physicians as having strep throat. So MD diagnosis, strep throat, and they turn out to have a culture positive is 44. Then 155 patients had negative cultures, and we put total of negative cultures is 155. The doctors diagnosed 53 of these as having strep throat. So the difference between this should be the answer here. But what is really this? This is your true positive. This is your false positive. This is your total true positive plus false neg. Because what is this here? This is your false negative, because MD diagnosed it as negative, but actually these people right here have strep throat. This is your false positive, because the MDs diagnose them as positive for strep throat, but they do not have strep throat on the culture. And this will be your true negative. Why? The MD diagnosed and the throat culture confirmed that these people in this cell will be your true negative. So adding all the positives, both true and false, should equal your and true positive and false positive. And this cell here, by just adding the negatives, it's false negative plus true negative. When you have this data, you'll now be able to expect to calculate correctly your positive predictive value, your negative predictive value, the sensitivity of the doctor's ability to diagnose, and the specificity of the doctor's ability to diagnose no throat culture or negative for throat culture. So good luck, and the group is expected to finish this and submitted by April 25th before 11 o'clock in the morning. I also attached a grading rubric. Just by finishing this exercise on time, the group gets 15 points. Accurately calculating questions 2 to 5 and having an accurate table gives the group 10 points. And mechanics, grammar should not play too much in the role, as long as you don't have a wrong spelling or grammatically incorrect statements. The group gains 5 points for a total of 30 points for a perfect score. Good luck and have fun calculating.